Hello and welcome to 72 Dragons House. Today we had the pleasure of speaking with Midori Higa. Midori Higa is the membership chair of the Caucus on Homelessness within the American Public Health Association, APHA. The caucus was established in 1990 to provide a platform for professionals addressing homelessness and health issues, exploring causes, healthcare needs, and the impact on families. She plays a key role in managing membership activities, contributing to the organization's work on policy and program development in this field. Midori Higa is the Director of Homelessness Resolution Programs at the City and County of Denver, Colorado, leading efforts to make homelessness rare, brief, and one-time occurrence. She has held several leadership positions, including One Home Program Manager at the Metro Denver Homeless Initiative and Director of Social Services at St. Francis Center. Welcome to this interview, Midori Higa. We are honored to have you with us today.
Thank you so much.
Midori, can you share your journey into public health and your role in the American Public Health Association, APHA, Caucus on Homelessness?
I got into public health after doing a lot of direct service work. Many of my friends have gone into social work, but I was not interested in social work and wanted more tactical skills. So I pursued my MPH so that I could learn different skills and pursue more leadership opportunities, which I've been able to do. Before I got my MPH, and during my time getting my MPH, I became really interested in the field of homelessness because there's so many different intersections. People experiencing homelessness, while it's its own subset and group of people, it also intersects with healthcare, it intersects with housing, it intersects with other types of social services. It occurs in all types of populations, single adults, families. There's a lot of interesting facts around homelessness, around BIPOC folks being overrepresented in the population of people experiencing homelessness. And so really wanting to address all of those inequities and intersections that come along with it. And I became involved in the American Public Health Association while I was a graduate student at University of Illinois at Chicago. And continued to go to the annual meetings and opted to join Caucus on Homelessness and become the membership chair several years ago.
Thank you for sharing. As the Director of Homelessness Resolution Programs at the City and County of Denver, Colorado, what are some of the efforts you are focusing your work on?
Yeah, the City and County of Denver in the last year plus, since our new mayoral administration with Mike Johnston, we've focused a lot of our efforts on unsheltered homelessness and really trying to reduce the number of people experiencing unsheltered homelessness by bringing them inside. So last year, our effort was really focused on trying to make sure that we had a place for folks. So developing much larger shelter system, which we were successful at and brought over 1,000 people inside last year with the goal of bringing another 1,000 people inside this year. And we're also focused on flow through, so getting people into housing, knowing that keeping folks housed will prevent or eliminate other health disparities and also allows them to become more stable, so they're utilizing emergency services at a lower frequency. So our goals this year are really around getting folks housed and out of the shelter system, and we'll continue to expand upon that for our overall homelessness response system.
Sounds like great work. Now, homelessness is a complex challenge to tackle. Can you discuss any successful initiative or programs that seem promising either in Denver or nationwide?
Of course. Denver took part in the Social Impact Bond project several years ago, and we were able to show through randomized trial that providing supportive housing for folks experiencing homelessness is really a key need and element of ensuring people are able to stay safe and housed. So that also showed a reduction in other types of services like jail services and potentially reduction in emergency visits. So to expand upon that, Denver is also participating in a new similar random control trial called CIPRA, or the Social Impact Pay for Performance Results Act, through the Department of Treasury, where we're also exploring how providing housing supports people in jail reduction and Medicaid spending reduction. So not using those emergency services. So we're partnered with a number of agencies that serve people experiencing homelessness, as well as our safety net hospital, Denver Health and Housing. And so we've been working on that thus far. A year and a half into the program, we're showing promising results with keeping people housed and reducing those jail days.
Sounds promising. Now, when we talk about social determinants of health, how helpful is this approach when addressing homelessness?
Yeah, I think the social determinants of health play a large part in homelessness. When we look at or understand homelessness in the context of US culture, we really see that there's a loss of connection for people that end up experiencing homelessness, right? So they lose their connections to their family, their friends, their resources, and so they don't have the safety net that they need in order to be successful. So part of that is being able to rebuild out those social determinants for folks and creating a community and an environment that they're able to be resilient and overcome challenges that are presented to them. And some of that is also creating systems that understand homelessness and address it in a way that's useful. So while we have a healthcare system that can provide healthcare, it doesn't always have a medical home model for everyone. But we know a medical home model works for most people, right? Or if we create mental health systems and we know that institutionalization is bad, but our mental health systems don't have enough providers, then we're not still able to address the needs of those folks that are most vulnerable when they have immediate needs and can't wait for 60 or 90 days for an intake to see a mental health provider.
Thank you. Now, APA Shade is approaching. What should we look forward to from the caucus on homelessness from this year APA Shade in Minneapolis, Minnesota?
Yeah, I love going to the conference and seeing all of the different caucus presentations. There's so many different scopes that happen there. So it really provides folks an opportunity to see, here's what folks are working on with Veterans Affairs. Here's what folks are working on in a school setting. Here's what folks are working on as researchers, or even here's what folks are working on as healthcare professionals. And I really gain a lot of perspective by having all of these different people from different walks of life in public health coming together to share their research and the things that they've learned. It helps spark for me as a government employee, what else can I be doing or who else can I be working with to create sustainable change for people experiencing homelessness?
Thank you. Midori Higa, thank you for our conversation today. Your dedication and work in helping the homeless community are truly inspiring. We wish you much success in the upcoming APA Shade 2024 annual meeting and your future projects. Thank you very much.
Thank you so much.